Hello everyone, welcome back to my channel. If you're new here, please take a moment to subscribe so that you don't miss out on any future videos. Today we're going to talk about heart congenital defect. A congenital heart defect is a problem with a heart structure that is present at birth. Some are simple and some are complex. In most cases, the cause of congenital heart defects is unknown. It can occur in babies with a family history of heart defects or babies whose parents have certain genetic disorders such as Down syndrome. It can also happen if a pregnant woman has been exposed to certain viruses or toxins. Sometimes it can be caused by an error in the genes that occurs before birth. Babies born with heart defects may appear normal or have other noticeable physical characteristics depending on the condition. Many people live full and active lives with minimal limitations despite having a congenital heart defect. However, others may require surgery or other treatment. Most congenital heart defects are discovered before a baby is born. Doctors can perform tests such as ultrasounds and other imaging tests during pregnancy to check for heart defects. If a defect is found, doctors can discuss the best course of action with the parents-to-be. In some cases, surgery may be an option after the baby is born. Other times, surgery may be necessary immediately after birth. It is estimated that around 40,000 babies are born with congenital heart defects each year in the United States. In this video, we will discuss several types of congenital heart defects. The first one is Atrial Septal Defect, ASD. The left atrium and the right atrium are two upper chambers of the heart. These two atria are separated by a wall called the atrial septum. An atrial septal defect is a hole in this wall. Blood normally flows from the right atrium to the left atrium through the atrial septum. But with a hole, blood can flow backwards from the left atrium to the right atrium. This can strain the heart over time and make it harder for the heart to pump blood throughout the body. Symptoms of an ASD include shortness of breath, fatigue, rapid heartbeat, and swelling in the legs, ankles, or abdomen. Treatment of an ASD includes medications to manage symptoms and surgery to close the hole. Surgery is usually recommended for children who are older than 6 months. The next one is a Ventricular Septal Defect, VSD. The left ventricle and the right ventricle are two lower chambers of the heart. They are separated by a wall called the ventricular septum. A ventricular septal defect is a hole in this wall. As blood flows from the ventricles, it goes through the ventricular septum. With a hole, some of the oxygen-rich blood from the left ventricle can flow back into the right ventricle. This can cause extra work for the heart, making it harder to pump blood throughout the body. Over time, this can lead to other heart problems. Symptoms of a VSD include shortness of breath, fatigue, rapid heartbeat, and swelling in the legs, ankles, or abdomen. Treatment of a VSD includes medications to manage symptoms and surgery to close the hole. Surgery is usually recommended for children who are older than 6 months. The third one is patent ductus arteriosus, PDA. The ductus arteriosus is a blood vessel that connects the aorta and the pulmonary artery. Normally, it closes when you're still in the womb. If it does not close, it is called a patent ductus arteriosus. With this condition, oxygen-rich blood from the aorta can mix with oxygen-poor blood from the body in the pulmonary artery. This can cause extra work for the heart, making it harder to pump blood throughout the body. Over time, this can lead to other heart problems. Symptoms of PDA include shortness of breath, rapid heartbeat, and poor weight gain. Treatment of PDA includes medications to manage symptoms and surgery to close the blood vessel. The fourth one is Tetralogy of Fallot, TOF. This is a group of 4 congenital heart defects that occur together. They are pulmonary stenosis, which is a narrowing of the pulmonary valve, an overriding aorta, which means the aorta is positioned over the hole in the ventricular septum, a VSD, which is a hole in the ventricular septum, and right ventricular hypertrophy, which is a thickening of the right ventricle wall. These 4 defects can cause deoxygenated blood to move through the body instead of oxygenated blood. This can cause a number of symptoms, including shortness of breath, cyanosis, which is a bluish color to the skin due to low oxygen levels, and fatigue. Treatment of TOF includes medications to manage symptoms and surgery to repair the defects. The fifth one is transposition of the great arteries. The aorta and the pulmonary artery are the 2 main blood vessels that carry blood away from the heart. Normally, they are attached to the correct ventricle. With transposition of the great arteries, they are attached to the wrong ventricle. This means that oxygen-rich blood from the left ventricle goes to the lungs instead of to the body, and oxygen-poor blood from the right ventricle goes to the body instead of to the lungs. This can cause a number of symptoms, including shortness of breath, cyanosis, and fatigue. Treatment of transposition of the great arteries includes medications to manage symptoms and surgery to switch the blood vessels to the correct ventricle. The sixth one is truncus arteriosus. Truncus arteriosus is a rare congenital heart defect in which the aorta and the pulmonary artery are not separated properly. Instead, there's a single large blood vessel that comes out of both ventricles. This blood vessel supplies blood to the rest of the body and the lungs. As a result, the blood from the right ventricle mixes with the blood from the left ventricle before leaving the heart. This mixing of blood means that the oxygen-poor blood from the right ventricle can dilute the oxygen-rich blood from the left ventricle. This can make it harder for the blood to carry oxygen to the rest of the body. This can cause a number of symptoms, including shortness of breath, cyanosis, and fatigue. Treatment of truncus arteriosus includes medications to manage symptoms and surgery to repair the defect. Coarctation of the aorta is another congenital heart defect that occurs when the aorta narrows. This narrowing makes it harder for blood to flow from the heart to the rest of the body. This can cause a number of symptoms, including high blood pressure, shortness of breath, and fatigue. Treatment of coarctation of the aorta includes medications to manage symptoms and surgery to repair the defect. The last one is pulmonary hypertension. This is a condition in which the arteries in the lungs become narrow. This narrowing makes it harder for blood to flow from the heart to the lungs, causing blood to pool in the right ventricle. Over time, this can cause the right ventricle to become larger and thicker. This can make it harder for the right ventricle to pump blood to the lungs. Symptoms of pulmonary hypertension include shortness of breath, fatigue, and swelling in the legs, ankles, or abdomen. Treatment of pulmonary hypertension includes medications to manage symptoms and surgery to repair the defect. These are just some of the many congenital heart defects that can occur. If you or someone you know has a congenital heart defect, it's important to see a doctor for diagnosis and treatment. With proper care, many people with congenital heart defects can live full and active lives. If you enjoyed this video, please leave a like and comment below. See you next time.